Hi, it's Rachel from Yoga for Pain Care Australia, and today I'm talking about what it means to be a Yoga for Pain practitioner, particularly if you're not a yoga teacher. It can be a little bit confusing. We do say that the training is not a yoga teacher training, and so what does that mean? So, as many of you know, Yoga Australia is the professional body in Australia for yoga, and they recommend 350 hours of teacher training to be an entry-level yoga teacher. So while a lot of clinicians, physios, OTs, nurses who come to Yoga for Pain practitioner training do actually decide later to become yoga teachers, or at least to do a yoga teacher training, it's not what we're intending for you, and it's probably for many of you not what you want. You have your profession, you have your field of practice, and so the question is, what is the role of yoga in that, within the realms of your knowledge and professional expertise? So I'll start by explaining what Yoga for Pain is. And Yoga for Pain, in the way that we do it at Yoga for Pain Care Australia, is a field of practice that examines the role of yoga in pain care. Now, the most obvious and talked about role for yoga in pain care is how we use yoga to help people with chronic pain manage, okay? There's a lot of research on this, and we've got some of that on our website. There's also a yoga and pain fact sheet, which has got summaries of the research. But this isn't the only role that yoga can play. So even if we look at the people with persistent pain, yoga as a full practice or full philosophy can offer us ways of making sense of our social environment and of our psychological environment. And this is important, yes, for self-management, for understanding, our triggers, what makes our pain worse, but also in terms of, for example, the prevention of persistent pain, because we know that people in certain situations and circumstances are more prone to developing these long-term pain situations. And another way that we would look at it is beyond management. What is there? And at Yoga for Pain Care Australia, we might describe this sometimes as sort of a rich, abundant life, which requires somebody to understand their, entire being, their physical being. So what's this physical education that yoga offers, but also the social education and the psychological education. And I talk more about this idea of yogic education in other videos. But beyond the person with pain themselves, if you think about how pain affects their families and how many different kinds of health professionals are usually involved, or the triggering circumstances that might have led to the situation of pain or that might be contributing to the pain. These are all places that we can use yoga and yogic education to play a role. So for example, one thing is we find a lot of clinicians say sometimes they're a little bit tired when they work with pain patients. It can feel very draining or maybe frustrating because you only have a limited amount of time. So, at a very basic level, you could look at yoga as the way to help clinicians, relax and develop their own resilience, for example, if they're dealing with complex patients. Or perhaps looking at how do I, as a clinician or provider, make sense of my own reactions to the people that I'm working with. And so in the training, if you look at the program outline, you'll see in the 6-day face-to-face program where we come together as a group, there's a section called Is It Practical? And it's teaching someone to move without pain. And so most of the yoga teachers, the way they go and do this is through their yoga class. A physiotherapist might be when you're giving somebody exercises, for example, for one thing. At the same time, you're doing it in a way that helps people not to make their pain worse. And as we know, that could be, a physical trigger that they do, or, how they're thinking about it when they do it. So there's a lot of realms there. If you're a psychologist, and this is the way one Yoga for Pain practitioner does use the methodologies, is simply in helping her clients to be more comfortable when they're in the session with her. If you work in a mental health agency and perhaps you run drumming classes as a social activity, how are people doing their drumming without making their pain worse? So there's a lot of many applications just of that one exercise that we do in the course. And you'll then see that there's a project that you do, and we suggest people do a 4-week project. And look, yes, a lot of people will use that time to teach a mindful movement small group class, which you can do if that's something within your realm. So for example, if you're a physiotherapist, you might have those movement skills, and so that's fine. Or perhaps you would team up with a yoga teacher in the course, and you might have a joint psychology yoga something together. Or maybe you work in a clinic where you get a yoga teacher in and you help them, so you become a little bit more like a course convener or overseer, and you think, okay, how do we use the yoga as a start for my clinicians to have a conversation about how we're feeling about this work with pain, how we're feeling in ourselves, how we're feeling about our workload, how we feel about our pain patients, and how we do better work. So these are just some of the possibilities. There are so many things that you could do. And the way that we approach it in the Yoga for Pain Practitioner training is to say, okay, who's the group that you would really, really like to support? And then how do you do a really in-depth look at what they need and what you can give them in 4 weeks that's going to make the difference in their life, in their livelihood, in their profession. So these are just some of the ways that you can apply the role of yoga in pain care, whatever your profession is. And particularly if you're not a yoga teacher. But even if you are a yoga teacher, you're going to have other skills that you can build into this. And you're still teaching yoga, but you build in a whole lot of things. And likewise, you're still a psychologist if you're a psychologist, but you have an understanding of yoga that informs how you work with people.